IV dressings are applied when the IV is inserted and when the IV site is changed. The dressing may be changed earlier if it becomes wet, soiled, loosened, or removed.
Ms. Baker, your dressing has come apart.
Questions to consider in your planning include the following. When was the dressing last changed? What type of dressing should be used based on agency policy and individual factors, such as the patient's sensitivity to adhesives? Is the patient at risk for infection or other complications, such as needle dislodgement and infiltration?
Hey, Ms. Baker, I'm back. Wash my hands. Got all my materials. I just want to look at.
Collect your supplies and wash your hands before you begin. When changing the dressing for a peripheral IV, use disposable gloves. Apply gloves and gently remove the old transparent dressing from the IV site, taking care not to dislodge the IV. Secure the catheter or needle hub with your non-dominant hand as you remove the dressing with your dominant hand. Observe the insertion site for signs and symptoms of infection, specifically redness, swelling, and exudate. The infusion site must be changed if there is infection. Also check the site for signs of infiltration or phlebitis. The infusion will need to be discontinued if there are signs of infiltration, phlebitis, or clot formation, or if ordered by the patient's physician. Then stabilize the vascular access device with one hand and use adhesive remover to cleanse the skin as needed. Keep one finger over the device at all times until the tape is replaced.
Okay, Ms. Baker, I'm just going to clean off this site here.
Using a circular motion, cleanse the IV site with alcohol, then povidone iodine solution. Start at the insertion site and work outward, creating concentric circles. Allow each solution to dry for 2 minutes. Prepare to apply the dressing. Caution Mrs. Baker to keep her arm very still. When applying a transparent dressing, carefully remove the adherent backing. Apply one edge of the dressing on Mrs. Baker's skin, and then gently smooth the remaining dressing over the entire IV site, leaving only the end of the catheter hub uncovered. Remove and discard your gloves.
Okay, got it all done. I'm just going to secure this IV.
Then anchor the IV tubing with a piece of adhesive tape. Do not place the tape over the transparent dressing. Write the date and time of dressing change and the size and gauge of catheter on the dressing. Then discard your equipment and wash your hands. Always observe the IV flow rate and compare with the rate observed prior to the dressing change. Make any adjustments needed to maintain the correct flow rate. Remind your patient to alert you to any problems with the infusion. Have the patient report wetness at the infusion site, pain, or swelling.
Okay, Ms. Baker, I'm going to keep an eye on everything. Everything looks fine right now. But please turn on your call light if you're experiencing increased tenderness or pain, or if you notice any swelling coming from your hand, okay?